We've known forever that hospitals can be dangerous places and we deal with some very challenging patients. And so we started thinking about modeling a response team after our medical response team colleagues. It's the Behavioral Emergency Response Team, or BERT team for short as we call it. So the members of the team consist of RNs. We also have the Riverside County Sheriff's Department deputies that respond with us, and also our private security from the hospital respond to our calls. And then we consult with our members from the Psychiatric Consult Liaison Services team.
Team started in January of 2019, very small, one person. Jim White was our initial person, and he started to put it together.
Initially, when I was thinking of starting this team, it was very one-dimensional. I thought about protecting our staff from danger. But when you look at the clients that we serve, mental health is a very big part of our society. And a lot of that is secondary to trauma that people have experienced in their life. So you really have to understand what people have gone through that have brought about these problems to have the proper compassion. Most of our calls are related to someone who is either violent at that moment or threatening violence. They probably are in a crisis. They are usually on a mental health hold, and they're very upset with the circumstances that brought them to the hospital.
We noticed that we had a pretty significant number of code greens, which is a code that is called whenever a patient is becoming so aggressive that they need manpower.
I'm very thankful for our partners. Our deputies and our private security play a wonderful role. They allow me to do what I do well, and that's to get in close to a person and form a rapport very quickly. And they're my safety person. They're watching the person, and not only will they step in, but they've stepped in many times and saved me from injury and allow me to try to bring the situation down as quickly as possible.
So historically here in Riverside County, the Sheriff's Department has been present in the medical center to provide primary law enforcement and security services. We're now, with the presence of the BERT team, our deputies feel that they play more of a support and peacekeeping role. And the solutions are really medical based and rest upon the shoulders of the medical teams that are there.
What we have noticed with the Code BERT team is already, since January, we've reduced our number of code greens by greater than 50%, sometimes even as much as 75%, as well as the number of staff injuries. The staff in the organization, I get emails all the time that say, thank you so much to Jim, thank you so much to your team. Violence in the workplace is a national problem, and here we are trying to address it with the BERT team. The BERT team is our way of responding to the mental health crisis and the violence that's going on across the country.
My team, I'm amazed at the members I have. We all have a compassion for people, and illness is an illness. And every person is valued, and we want to treat the whole person and not just look at what those diagnoses are.
The vision of this team is to reduce our code greens to zero, have no patient or staff injuries, and then to just expand the program to cover the hospital and meet the needs of the patients and the staff.